share the slides while we introduce ourselves. Welcome everyone to our webinar for the CHIPS Masters and Certificate Programs. My name is Jen Myers. I am the director of the center, and I will hand it off to Kathy Shaw.
Great. Well, welcome to our Information Center session, and we're going to talk about the offerings that we have at CHIPS, the Master's and Certificate Programs. Next slide. I'll give an overview of what Penn CHIPS is and the program features, the courses and the format, and the student body types and roles. Jen Myers will talk about. Karen Shala, who is our director, will do the FAQs. But we want to spend most of the time actually for our panel of current and recent students to tell you about the experience and answer your questions in the Q&A session. Next slide. Our mission is simple. We want to improve the quality of healthcare for patients and patient populations by training the next generation of practitioners, leaders, and researchers in QI and patient safety science. Next slide. Our missions are, of course, education, and CHIPS houses 3 educational programs. We'll talk about 2 of them in this one. We're lucky in that across our health systems, we have over 50 healthcare quality and safety experts serving as faculty and advisors. A lot of the work that we do, it's high quality, so there are a lot of publications coming out of CHIPS and its graduates, over 150 so far. And we are really part of the community at Penn. We have worked with both Penn Medicine, Penn Nursing, and others, and we like networking across all of these groups. Next slide. And this talks about the unique partnership. This is a very much an interdisciplinary program. In addition to CHOP and Penn Medicine, we have Penn Nursing involved. Next slide. The leadership, Jen introduced herself, and I'm Kathy Shaw. I'm also the Associate Chair for Quality and Safety for the Department of Peds. We have Jess Hart, who's the director of our certificate program and leads a lot of the GME and quality education programs at CHOP. Sue Keim is the director of the Masters in Science of Nursing programs, and she is our nursing liaison. Neha Patel is the director of resident and student initiatives. We have plenty of programs and scholarships for students and fellows. Shazia Sadiq, one of our graduates, is the Director of Research and Scholarship. And Karen Shala, who will be hearing for, is our Associate Director of Operations. Next slide. I'm not going to read all of these out to you. It just gives you an idea of the depth and breadth of the various course directors. They are from all types of medicine and nursing, both adult and pediatrics. Some are researchers, some are operations people, but everybody are quality improvement and patient safety oriented. Next slide. So who should apply and why should you apply? Obviously you're on this webinar, so you've recognized that we need to improve healthcare delivery systems, and that we all know that medical errors are the leading cause of death in the U.S. And I love this quote, in healthcare, everyone has 2 jobs, to do your work and to improve it. There is actually a requisite skill set to effectively lead quality and safety improvement activities in healthcare, and Penn CHIPS provides the opportunity to learn and also apply these skills. You'll all, as Jen will tell you, will all do a capstone in your area. And it allows you also to explore careers in quality and safety, administration, operations, research, and education. Next slide. And who can apply? This is the fun of it. Really, it's very interdisciplinary. We have physicians, nurses, NPs, PAs, pharmacists, social worker, dentists, veterinarians, administrators, literally anyone who wants to work in healthcare, but is also involved in leading improvements and wants to be more involved and desires more formal training and skills and mentorships. Next slide. And I'll turn this over to Jen to talk about the master's and certificate programs.
Thanks, Kathy. Good morning again to everyone. So we're going to talk about two of our programs in the next few slides, but we just wanted to highlight a few things that's common to both programs. They are specifically designed for professionals with busy full-time schedules. All of the students receive one-on-one mentorship from our faculty and an assigned advisor. You get exposure to that community, as Kathy mentioned, and our expert faculty. It's an interprofessional learning environment, and really all students are learning how to operationalize their insights and ideas to improve patient care outcomes and lead change in their workplace through an experiential capstone project that they design. Next slide. Okay, next slide. So these are going to be the meaty detail slides, and happy to take questions from any of you at the end related to this. So our program format, both our master's and our certificate involve face-to-face in-person learning, some amount of online virtual learning like we're doing now, and they all involve students to work experientially on a QI project in their home, hospital, and area of interest. It certainly could be ambulatory or another healthcare setting. And really that's a key. We feel strongly that you can't learn this work without doing it. And you'll hear more about that from our students. In the bottom left, you'll see the time frames. The vast majority of our students in both programs do this part-time, but full-time is also possible. So the certificate is designed to be done full-time over 1 year or part-time over 2 years. And the master's is designed full-time to be done over 2 years. Part-time, our average graduate is completing it in 3.5 years. Next slide. This is our educational pathway slide. So essentially, the certificate courses are there in the blue. These are our core courses. There's 2 courses on the principles and practice of QI. There's a course on systems thinking and patient safety, and they, if you wish, can lead to the master's. And about 1 in 4 of our certificate students actually goes on to complete the master's. What you're seeing on the right are all of the courses that are required for the master's. You'll notice that in the certificate, there is room for 1 elective. And essentially, you can select any of the courses on the right to take as an elective. In terms of the electives that we offer, which again are requirements for the master's, we have a course on healthcare quality that goes over the landscape and standards, sort of the national view of healthcare quality. We have a course on evaluation and measurement, a course on applied clinical informatics for QI, a course on leadership in quality and safety, and finally a new course in using QI to achieve health and healthcare equity. Next slide. This is an example of really like the flow of the courses in your experience over 2 years, if you did the certificate over 2 years. So in the fall of year 1, you learn how to design and set up a quality improvement initiative for success. In the spring of year 1, you learn how to display QI data and manage change through PDSA cycles or plan, do, study, act cycles of change. And at the end of that year 1, you'll have a presentation and a poster to the course directors. Then in the summer or second part of your second year, you can take any of the electives that I just mentioned. And in the fall of year 2, we have a systems thinking and patient safety course where you'll really learn the principles of systems thinking and foundational concepts in patient safety. And all of this results in a final capstone presentation to graduate. Next slide. This is the master's, so just more content, right? The courses highlighted in yellow are certificate courses, but I should mention here that our master's and certificate students are all intermingled in the same class. And so you'll get to know everyone throughout the program. And then this is just a sampling of how you could create a program of study with the other required students in the master's. And then at the end of the master's, to complete the master's, it's in addition to a presentation, you actually write a paper using the standards for quality improvement guidelines. And as Kathy mentioned earlier, many of our students go on to publish their capstone, which is exciting to see. Next slide. So importantly, we wanted to share with all of you that we're transitioning our program format over the next 2 years in response to our students' needs. So what would that mean for you if you applied this cycle? Well, it would mean that next year, we're still in our traditional program format. Our core QI classes that you would take occur once a week on Thursdays. You would have 6 Thursday afternoons per semester in the spring, or in the fall, and then in the spring. And then 6 Thursday evenings would be virtual. So essentially, we have 12 to 13 classes per semester. About half of them would be in person, half of them would be virtual. Looking into the next academic year, fall 2025 and beyond, we are transitioning to something called an executive format. And what does that mean? Essentially, it's designed for busy working professionals. We have noticed that it can be challenging for people with full-time jobs to make it to a Thursday afternoon or Thursday evening class. Based on our needs assessment and interviews, we're transitioning to an executive format. So what that means is you would have 3 days of class twice per semester per course. So in the fall semester, you would have a Thursday, Friday, Saturday in September, and a Thursday, Friday, Saturday in November. And in the spring semester, that would repeat again in January and March. In between those sort of immersive blocks of time, there would be online Thursday evening virtual classes. It's important to note that if you're taking 1 class a semester, those intensive sessions would be half days. If you're taking 2 classes a semester, those intensive blocks would be full days. Next slide. This is just an example of a certificate plan of study if you were doing it over 2 years, showing that next year we'd be in the current format, having classes weekly on Thursdays, either in the afternoon or evening. And then in year 2, we would transition to that executive format that I just described. Next slide. And then here's an example master's plan of study over 3 years. Next slide. All right, a little bit about our students. This is our current enrollment by student type. We have just a little over 50 students in all of our programs. What you'll notice is we do have a lot of physicians. So 26% of our students are faculty, 10% are physician staff, 32% are fellows. But our largest growing slice of the pie are actually non-physicians. So many nurses, several nurse practitioners and PAs, other types of clinicians. We have a behavioral health specialist. We have a clinical research coordinator. We have a veterinarian who's an anesthesiologist. We have some individuals in QI administrative roles. So I think, again, the interprofessional nature of improvement work is finally trickling into our programs, and we couldn't be more excited about it. Next slide. This slide is a map of the US showing where our graduates are. One of the things that you'll notice is a lot of them are still here at Penn and CHOP, which we love, and 17 of them at Penn Medicine and 28 of them at CHOP have a leadership role, either at one of the downtown hospitals, one of the clinics, or one of the satellite campuses across the region. And then increasingly, we have a number of graduates leading across the country. So people who have changed jobs and moved, a lot of these are our fellows, but they have leadership positions in safety and quality at these health systems. Next slide. I'm not going to read all of these, but you'll have a copy of these slides to take a look at them. Essentially, these are current student and graduate roles in healthcare quality and safety internally. So variety of different roles: patient safety officer, improvement advisor, women's health quality manager, etc. Next slide. And these are the types of roles that some of our graduates have gotten externally. So you'll see they're all over the map, from Seattle to San Diego to Ohio and Hopkins. Next slide. Now I'm going to turn over to Karen to talk about the FAQs.
Hi, good morning, everyone. Oops, sorry about that. How do I apply? We have an online system that is through the Central University, and you would all applicants are required to submit their CV, personal statement, and 2 letters of recommendation. Our master's program does require transcripts, and master's program applicants will also have an interview. And the application for the current cycle is March 1st, 2024. When do the programs start? Both of our programs have programming that start in the summer, June 2024. And this is some helpful sessions that you would be involved in, getting connected with appropriate people to help you get a good launch when your coursework begins. The master's starts in summer 2024, and certificate students start their coursework in the fall semester. What is the capstone requirement? So both Jen and Kathy have already touched on this a little bit, but the capstone is a culminating experience that requires the integration and application of knowledge attained in coursework throughout your time in your program. And if you can remember those little visuals that Jen showed, you're really working on your capstone and your PDSA cycles throughout the entire time of your time in the program. 2 of the core courses, both Principles and Practice QI1 and 2, teach you the methods and skills needed. You will have a faculty advisor assigned to you that will work with you longitudinally across your time in the program. And then our master's students take a capstone course where they are writing a manuscript. And again, like I said before, many times these students publish their work. This is one example of one of our certificate students who recently completed their capstone project and actually was the winner of the 2023 Pennsylvania Hospital Quality and Safety Award. Melissa McKinney, her project was giving babies their best shot, improving Hep B vaccine administration in the Pennsylvania Hospital Intensive Care Nursery. And you can see on the bottom right the increase of babies who received the vaccine within 24 hours of life. This is one of our master's students, Elena Wang. She's actually also one of our teaching faculty, and her capstone for her master's program was actually recently published in Academic Pediatrics. And her project was across the entire CHOP primary care network, and it was for the HPV vaccine completion by 13. Where are classes held? Our in-person classes are held at the School of Medicine and the School of Nursing at 34th and Spruce Streets. What if I am interested in just 1 or 2 courses and not a whole program? We really do encourage students who are not ready to, or maybe not interested in enrolling in a whole program, to take one of our courses. We have plenty of students who take just 1 or 2, and maybe that's it for some time. And we have plenty of students who take 1 course and then they decide to apply into one of our programs because they got their feet wet. Are there tuition benefits? So your employer may have tuition benefits. Some of you may not be from Penn or CHOP, but if you are from Penn or CHOP or the University of Pennsylvania and you're a full-time employee, you do have tuition benefits. What if I am a certificate student who wishes to further my education and pursue the master's? So like Jen mentioned before, 1 in 4 of our certificate students do proceed to apply to the master's program. And the application is fairly similar, but a little bit pared down, and there's the same deadline for each year. Kathy?
Yes, well, I think the best thing to do is to have you talk to people who have recently completed or are in our programs, and they are each going to introduce themselves. And we have people on from a variety of specialties and also health systems. So I will let each of them introduce themselves. I guess we'll start with Sean.
Great. Can you guys hear me?
We can.
Okay, great. And just so I understand the format, we were given sort of some prompt questions. Should we run through those questions or start with a round of introductions and then delve into the questions?
I guess you could, are you gonna,
I just don't want to yammer on for too long if
yeah, okay. Why don't you each introduce yourselves and then we'll go through
Sure.
the questions.
All right, sounds good. So I'm Sean Foster. I am an emergency room doc. I work at Penn. I am also the Assistant Chief of Emergency Services at Presbyterian and the ED Director of Quality Improvement for the Presby ED. And I did the certificate program.
Okay, I see Chrissy next. So how about if we do Chrissy?
Good morning, everyone. My name is Chrissy Franciscovich. I am a neonatal nurse practitioner, and through the time in this course, I have advanced and now have a specialty role, and I am the patient safety and improvement advanced practice provider for Children's Hospital of Philadelphia.
Great. Laurel?
Hi, good morning. Laurel Glazer. I'm a pathologist. I'm the director of the microbiology lab at HUP and Presby. And I also am the medical director of our Path and Lab Medicine Quality Office. And I lead the residents in their quality and safety education. And I finished a certificate program maybe 3 years ago.
Thanks. Arun?
Hi, good morning, all. My name is Arun Srinivasan. I'm a pediatric urologist in Children's Hospital of Philadelphia. Actually, I took the certificate program, and I was one of the guys who jumped over from the certificate to master's because I really liked what I was hearing. And I'm actually in the final stages of my master's. So this semester is my last one, and I just submitted my final capstone project. And nice to meet you all.
So while we have you on, why don't you go ahead and start, Arun, and talk to us about your experience?
Sure. Yeah. So a couple of things, as Sean mentioned, I just wanted to touch on all the highlights that Kathy and Jen wanted me to talk about. I'm going to start with why. The value in healthcare is driven by now, particularly, is driven by efficiency and quality and safety. It's about driving. It's going to be the driving motor for all our healthcare directives going forward, and we have to be involved in the process to be part of the solution. What do I find most helpful with doing this course, with the structure of this course? The camaraderie, the breadth of people you come across and meet that otherwise you would not have chance to meet, the knowledge dissemination, and the support generally by the program managers and by the support crew. Understanding that this is not the only hat you're wearing. They understand that very well. You have a full job and you're going to do all that and be very courteous of your time and effort. As I said, I just finished my capstone project, so I'm in the final stages, and I can tell you this could not have happened without great support from Kathy and Jen and Kirsten and Karen, Stacy. They all been, extremely responsive whenever I asked any questions. And this whole journey took me 3 years to finish this master's, but here I am. This needs support from your worker. It needs support from your family, but definitely the support is here from the program perspective. They have a lot of electives, and I want to add one thing that I found an elective about equity that I really wanted to do as my thing, and they were very supportive of me choosing that elective and including that as part of my graduation process. So I don't have enough good things to say about this whole journey I've been through with them for the last 3 years. Thank you.
Thanks, Arun. I'm just going by who I see next. Sean, you're up next.
Great, cool. All right. So for me, the decision to get involved in the certificate was, I think, a couple of sort of simultaneously converging things. One, I had been in the quality role that I'm currently in for a couple of years, but without any formal training, and was sort of increasingly aware of the gaps in my understanding of quality improvement. I'd had some sort of informal, course here or there training, but I just felt like what we were doing was sort of like whack-a-mole. We were doing these short-term fixes to little problems as they came up, but it didn't feel like we were building sustainable, spreadable solutions. The second thing was I was starting to be approached with questions about mentoring others in quality projects, like students residents, junior faculty, and that sort of really illuminated for me the gaps in my own training and understanding. It was a big motivator. And then the last thing, which is probably, I'm guessing, a common thread for a lot of students, is that my department leadership was really supportive and encouraging of professional development. And that was huge for me in terms of exploring and then ultimately making the decision to, to get over the hump and actually put in the application. In terms of my capstone project, so I was lucky in that because I had been doing quality work for a few years, I had some options. I ended up just picking the one that lined up temporarily with my time in the program, which was a project looking at our departmental performance on a national core measure dealing with sepsis. That was, I think, a good choice for some reasons. I had an existing data feed, had a good understanding of the project, and we had some sort of preliminary data that allowed us to do a good analysis. The project was also nice in that the core measure we were studying is multi-part, so was amenable to rapid sequence interventions rather than just one change and done. There was certainly hiccups along the way, and it's a project we're actually still working on. But I guess my advice would be, if you're thinking about getting in the program, it's never too soon to start thinking about what kind of a project you might want to be working on, and to start asking yourself questions like, do you have access to data, et cetera. In terms of what I found most valuable about the program, for me, I think, again, it was just filling in sort of a framework of understanding. I think the curriculum is really thoughtfully designed to sort of give you a picture of the whole breadth of quality improvement, the whole landscape. And I really enjoyed that there was, even in just a 4-course curriculum in the certificate program, I enjoyed that there was the opportunity to do an elective, which for me, I took the April Taylor's course on evaluating quality improvement. I just found that so valuable. It's something that I use, if not daily, definitely weekly. So I thought that was a really neat feature. And then in terms of how to manage going back to school as a full-time employee, I think Jen touched on this, but it felt like almost everybody there was full-time, and it seemed like all the course directors were really cognizant of that, and all of the work was very reasonable. It seemed like the time in classes was spent thoughtfully, and the amount of after or outside of class work was kept to a very manageable level. So I didn't find it difficult at all. And I did it over 2 years, and I like the flexibility and the time frame as well. So again, just like Arun, I have nothing but positive things to say. I think it's a tremendous offering, and happy to answer anybody's questions.
Thanks, Sean. Laurel, I see you next.
Thanks. Yeah, as a resident, I had an interest in patient safety and quality improvement. And I had done a couple of joined in a little bit for the resident track that was just kind of forming at that time. And so when I saw that, as I had graduated and then stayed here at Penn and saw that there was the certificate program, I was immediately interested, and it was really fantastic. And I encourage everybody, if you're not sure, take one class. If you take it, I think you'll stay, because you'll just learn an incredible amount. It was a really enriching experience. For me, I think one of the most important things I took away from it was just learning the language of quality improvement. And I just think this health system is learning the language together over the last many years. And so when now I'm on calls with nursing, with quality improvement leaders, I understand what they're talking about. I see the flow of the way projects go. And to me, that was just really valuable. In our department in pathology, a lot of the quality was happening at the operations level, and the faculty has not been as engaged in that part of it. And so I think this was really great also to just be really interdisciplinary, to be able to come back and work with people in my department in all different areas. I mean, it was really terrific. And so that was a huge win for me. For my capstone, around the time we were having a huge issue in our lab with having to cancel patients' FIT testing for colon cancer screening. And so I worked on ways to encourage patients to return their kits properly labeled and in a timely fashion. And actually, same as what Sean said, that work is ongoing. And the people I met in my capstone, a lot of people I work with now in other projects, because we got to know each other and we're continuing this work together. And so really the capstone, great to choose something in your area that's going to be long-term, because it doesn't, it's a short project and it was kind of just getting our feet wet. So I also found that really helpful, in making those connections and having that mentorship. And then the last thing I'll say is I'll just amplify what Arun and Sean said, which is that it's completely doable as with your full-time job. I think I finished my certificate during COVID where we were, busy bringing up testing. And so, their program's very flexible and they'll work with you. And I think as long as you have the support of your department for those like afternoons that you're going to need free from clinical duties, there's not a ton of work to do, like homework to do afterwards. It's completely manageable.
Great, thank you, Laurel. And Chrissy, you want to bring it home here?
Yes. Hi, everyone. So what really got me interested, so I had taken a part-time role as the medication safety nurse practitioner at my institution and was doing quality improvement projects really without a framework for several years. And then I had said, I'd become interested. I wanted to do more of this. So I started to do a Lean Six Sigma course. I took the IHI RCA squared course. I took the leading improvement course at my institution and really was so interested in it. And I thought, I want to move forward. And knowing that we have this program that's so unique right next door, I enrolled in the master's program. I'm still enrolled in the master's program. I'm over halfway and I love it and I'm getting there. No complaints at all. It's a wonderful program. I would say the highlights for the program are what everyone has shared is the leadership and administration and mentorship. I haven't been in one of Kathy's course for a long time, but she's continuing to mentor me through and help me with my capstone projects. And also meeting and networking with people from different areas and different hospitals and different walks of life, I thought has always been really a nice way to build on your own quality improvement. And then even within your institutions, when I work clinically and networking with some of these leaders and other quality improvement specialists has been really helpful to have that similar mind frame. I would say for my capstone project, I had picked a medication safety related project to reduce automated dispensing cabinet overrides, medication overrides. And that's basically when a nurse would take a medication out of the cabinet before a pharmacist had verified it, and it could lead to increased medication errors. I am happy to say that the quality improvement project is, my capstone is in manuscript form, and right following this course, I'll be submitting to BMJ Quality. I'm publishing on 17 months of sustained improvement, but there's been nearly 2.5 years of sustained improvement at this point. And then managing going back to school, I think it's been, it's been very achievable. It is nice to have support from your family. There is some time that you'll be away, but I think it's always been a very manageable, the amount of work that happens outside of the course, and it's enjoyable. So it doesn't make it seem like it's a lot of work. So I have also found the same as my colleagues here today, that it is quite doable. And, have achieved some other major milestones, even at work in my personal life during the course. So highly recommend it. Happy to take any questions.
And I think that's what we would like to do, is open it up to questions for those who are exploring this possibility. Maybe if you're able to come on video, we'd love to see you and hear your questions.
Oh, Jose?
Yeah, thanks for those introductions and information on the course. I guess one thing I was wondering was, in looking at the difference between the certificate curriculum and the master's curriculum, the difference in electives, is that pretty restricted as to the electives you could take in the certificate versus the master's? Just because I guess one of the things I was interested was the human factors, but wasn't sure if I am ready to fully commit to something like the master's curriculum.
Do you want to take that, or would you like me
Yeah.
to, Jen?
I'm happy to take that. Generally, for the certificate program, we recommend that you take an elective within our program. So one of the healthcare quality and safety courses. And so most students will take something within ours. We have had students take human factors engineering as their electives. That program or that class sits within, believe it or not, the School of Engineering. And it's an undergraduate and graduate level class. I think, Chrissy, you might have taken it, or maybe not.
I did not take that one.
You did not.
I will say two things. One is that if you're interested in exploring this field and want some exposure to human factors, systems thinking and patient safety, a whole 3-hour session and module is devoted to human factors, but you'd have also a taste of everything else in systems thinking and safety. And that might be the way to start.
Right. But I will share that many of our students have taken human factors engineering as a full class, as an elective.
However, as it is an undergraduate course, I
It's a
think
lot of
everybody who's taken it has really wanted to take it and has enjoyed it, but it is not geared to working professionals. You're in with undergraduates and a fair amount of work.
But a fascinating field that is very relevant to safety for sure. Other questions? Feel free to come off mute and shout them out, raise your hand, put them in the chat. If you're thinking of a question, it's very likely that somebody else has the same question.
We have a quiet crew.
Yeah.
We've either answered all of the questions or they're thinking.
I have a question around the tuition again, if that's okay.
Sure.
So I had seen at one point that there was like a scholarship opportunity, but would that be in addition to any other financial support that that Penn, it's, you know, the tuition assistance itself as employees would be, or is that separate from?
So our staff scholarships are separate and above. To answer your question simply.
Okay, yeah, great, thank you.
Yep.
Jen, can I add in there too that the leadership and the administration is also very willing to share when there are other external scholarship awards that become available. And I have applied for one as well. So there may not be just the ones you see today. There may be more that become available. And Stacy and Karen have been very quick to share those opportunities with us.
Other questions? We were expecting questions about our format change. Anybody have questions there?
There is one question in the chat. Is there an ideal time in the certificate program to make the transition into the master's track? You know, we can see if Arun wants to answer that one, but I will tell you that usually it's happened both ways. People have taken the 2 core courses and realized, oh my, I won't be done after the 4, and have really asked to transition within a year. And others have finished it and said, thought about it and said, okay, now I'm ready for the master's. So it's really whenever you think. There could even be, you know, you could have done the 4 courses, taken a year off, and then decided to apply. We've had people do it every different way.
Yeah, it just took me one. But so I see a huge value in mastering in this particular area of healthcare delivery, particularly as a surgeon. I think there is a lack of people who who do this in an expert way. And essentially, once I got a taste of it, I really wanted to just get the master's because that adds a lot of value. It gives you a lot more breadth and depth of knowledge of the same area. So it just took me one, but again, not one. That's just a choice that I made.
Great,
Thanks,
thanks.
Arun. Any other questions?
Can I, oh.
Mhm.
Please.
Go ahead.
Just kind of wanted to go back to the format. So applications are due March 1st, and then coursework would start in the summer, next summer, this upcoming summer. Is that correct?
Applications are due this spring by March 1st. If you are applying for the certificate program, your first course would be in the fall of 2024, would be my course, The Principles and Practice of QI. If you're applying to the master's, we recommend that if you can, you start with our summer course 601, Healthcare Quality, Landscape Standards, and Measurement. And that's a 1-week intensive course in June.
But again, we would emphasize, we understand people's schedules, and some people need a year in advance to be able to do a week intensive. So, we're willing to work around what works for you.
Jose.
I guess just thinking of one other question as I'm thinking of like other programs like Chrissy, I know you mentioned IHI courses, Six Sigma. As I'm thinking about comparing things like the CPPS certification and things like that, I think you've all kind of alluded to it, but what are the advantages of kind of this certificate/master's program over kind of a more general IHI type certificate?
Chrissy, you want to take that?
Sure. Yeah, definitely. Those are all wonderful courses, and I'm happy that I had them. I feel like they only really scratched the surface, and each of those was maybe targeted to a certain area. Like the IHI was very specific to root cause analysis. And Lean Six Sigma gave an overall framework, but the certificate and the master's would give you such more an in-depth understanding and framework to build on, that for me, that just felt like the very beginning. And similar to Arun, I only had to take one of those to know that I wanted to do more. And I don't think you would get that same quality. The quality of the speakers that we've had in the courses throughout the master's program has been exceptional. And so again, those courses are wonderful, and I think it gets a nice stepping stone, but just don't have the depth or quality that the program, the CHIPS program, can offer.
I think the other thing I would add on to what Chrissy said, Jose, is that in those programs, which again are excellent, you don't have the in-person networking opportunities. So I'm not sure what your profession is or what side of the street you're on, but just being in class with other people from other disciplines and other specialties that are doing improvement work really enriches the learning. Other questions? All right, well, it's 8:45. Kathy and Karen and I will stay on for a few more minutes if folks want to log off. If you have a private question you want to ask or something more in-depth one-on-one, we're happy to go through it with you. But otherwise, I'd like to thank our panelists for sharing their experiences. Hopefully they'll be available to you if you want to have a one-on-one chat. And also, if you'd like to be connected with someone in your discipline, in your hospital, in your age range, just let us know. Our students are very flexible and have welcomed those one-on-one conversations so we can connect you. Otherwise, look out for more email information about how to apply. You'll get these slides as well as the recording. And we hope to see many of you apply. Have a great day.